Mark Heim, founder of Disaster Doc here with Module 11, Heat Waves. So let's go through those learning objectives together. After completing this lesson, students will be able to define the term heat wave, list the major causes of death in heat wave disasters, identify the risk factors for adverse health effects related to heat disasters, and then list the two major causes of death related to heat waves. The students should also be able to identify major public health consequences of heat waves and to recognize the health impacts of heat waves relative to other natural disasters, and to identify the deadliest heat wave on record that occurred in 2003 in Western Europe. And finally, list the three secondary disasters caused by heat waves. So the definition of the term heat wave. A heat wave is a long-lasting period with extremely high surface temperatures, and there's a variable list of definitions for heat waves, but I just wanted to kind of get one out there so that we can start talking about the same issue. And it's not determined by absolute temperature alone, but it's also dependent upon the acclimation of the population, the ambient temperatures, the temperatures that are around us, in addition, the humidity, and also the amount of air circulation in that particular environment, whether it be indoor or outdoor. And also the building types where we may live or where we may work, and also nighttime temperatures. Do those nighttime temperatures give us some relief during the sleeping hours? There are risk factors for adverse health events that are related to heat disasters, and these break down, of course, into that issue of exposure and vulnerability. So those people that are most exposed usually have older homes. They're usually more commonly in urban locations as opposed to rural. These are groups that actually have no air conditioning or poor ventilation or both. And also many times these occur in low-income neighborhoods, of course, because all those other factors come into play in low-income neighborhoods. So there are certain groups that are more vulnerable than others. Number one, elderly people are more vulnerable to these heat wave disasters than other age groups. In addition, people with poor cardiovascular health, so pre-existing arterial or heart disease, makes some people more susceptible to heat than others. Also, people that are socially isolated, so less people to check on them, less people to assist them in evacuating or cooling their homes, those people are also more susceptible to heat disasters. People of low socioeconomic status that have less resources to be able to call upon in order to be able to either cool their homes or to get themselves to cool locations. We also see racial minority, especially in the United States and prior events that have occurred, for example, in Chicago, where racial minority was also a risk factor. So once again, people that are socially isolated or otherwise disenfranchised from the health system, the public health system, or public outreach and services and so on. And also people who may rely upon refrigerated medications and then may lose that power during, for example, a heat blackout, when electricity is in high demand and the demands exceed the capability for the power generation to be able to reach those needs. Of course, the major cause of death in heat wave disasters is heat stroke. And what happens in heat stroke is the body is heated to the point where it can no longer cool itself down using its own mechanism. So we need medical intervention in these cases. These are very serious health effects when we talk about heat stroke. The other aspect of the heat-related illness that we see is also exacerbations of cardiovascular disease. In other words, heart disease that's already pre-existing, or stroke disease, or people that may already be at risk for heart attack or stroke, and when the heat wave occurs, it tips them over the edge, or it worsens that pre-existing disease, and people then succumb to that particular illness as well. So heart stroke and cardiovascular disease have been the big killers when we're talking about these major causes of death in heat waves. So now let's talk about the public health consequences of heat waves. And I want to point out to you actually that the number of deaths is actually converse to what we see, for example, in hurricane deaths, where we see developing nations have few deaths in hurricanes and so-called low resource nations actually have a large number of deaths. In heat waves, that's actually flipped. So we actually see high resource nations have more deaths from heat waves as compared to low resource nations. So we have a larger components of the population that may be elderly. We also have larger components that may be socially isolated or living in urban areas. May have other issues related to acclimation to heat whenever it occurs. And so therefore we see this kind of difference between high resource nations and low resource nations. We also see a moderate amount of heat illness or that doesn't progress to actually heat stroke and deaths due to this fact as well. And we also see this damage of the healthcare system. Once again, not functional damage, not damaged buildings and knocked out electricity and so on from these hospitals, but what we see is a large number of people that end up going to the hospital, needing medical care, needing emergency medical intervention, and that really puts a strain on the healthcare system itself. And then once again, people's concern for safety is high in these heat waves, but actually I think that people actually don't take this seriously enough in comparison to some other disasters, for example, like a chemical spill or an earthquake and so on, where people know that that's definitely dangerous. But people, because heat occurs and waxes and wanes over a period of time, I think people tend to say, you know what, I can get through this, and they try to get through this in a situation that's really actually much more dangerous than they can recognize. So we really have that need to be able to produce good information to people, to share that, to distribute that with folks that can make a difference and be able to really take that protective action, evacuation, getting into cooling shelters, getting into cooler environments, leaving those hot areas while the heat wave is going on. Of course, we can always return to home, but getting into those cool environments really has to occur before we get into this heat stroke phenomenon. I want to compare the health impacts of heat waves to other natural disasters because, actually heat wave disasters were the second highest mortality rate during the past 50 years compared to other natural disasters. Second highest. So the number of people that died per 100,000 people, second highest among all disasters. Also, second highest injury rate of all disasters during the past 50 years as well. So we can't really underestimate the impact of these heat wave disasters. These are pretty significant problems that have occurred and are actually occurring with more frequency as we look in the later aspect of those 50-year period. They were also the fourth highest for number of deaths per event during this past 50 years, and the death-to-injury ratio was actually the fourth highest for all natural disasters during that same period of time as well. So we're really talking about a large number of deaths compared to the amount of illnesses or injuries that occur in that particular natural disaster. I want to share with you now this table of the world's 10 deadliest heat waves over the past 50 years, and I want to point out that those that are marked in yellow in this particular table were all one single event in 2003. All of these were European countries that were impacted. So you can see I've broken this down, the top 10 deadliest by country, and number one was Russia, actually in 2010. But then number two, Italy, France, Spain, Germany, and also Portugal as well. All of those were associated with one heat wave that occurred in Europe in 2003. I also want to point out as well that many of these heat waves, when we're looking at the past 50 years, all of these top 10 occurred since 1980. So we're really talking about a much more common occurrence and much more severe in more recent times. There are also some of these secondary disasters that are caused by heat waves. Number one is power outages that can occur because of the huge demand, of course, for electricity, for cooling and so on, and that can actually cause the outages to occur and now complete loss of air conditioning capabilities, a secondary disaster or a worsening of the first, so to speak. In addition, as I mentioned, there's a stress on the healthcare system, increased demand, and also decreased resource options. So people may have less human resources to be able to make it to the hospital to work, or less options as well when we're talking about the ability to be able to have outreach into the community, ambulance systems that can go out and take care of people, or public health system that can go out and do outreach as well to be able to diminish the possibility of people succumbing to heat-related illness. There's also an increased demand for morgue services, and this was really reported most remarkably from the Chicago heat wave that occurred over the past decade, where we actually had large numbers of fatalities that occurred in Chicago that exceeded the capability of that particular morgue to be able to provide those services. So they then had to switch to mass fatality management. And once again, limited resources to be able to deal with those problems. And so we saw this sort of secondary effect of mass fatality was really a secondary disaster or a secondary problem as a result of this heat wave disaster. There are measures that can actually increase the health impact of these heat disasters, and these include human factors as well. Once again, back to that issue of poor building design and construction. So if it's a building that has poor air conditioning systems or has lack of ventilation and so on, or the way that the building is built in brick, for example, the structures that actually heat up during more inside than outside during the day, we'll see higher numbers of health-related effects from these particular types of construction. Also, poverty is a risk factor as well, because people, of course, have less resources to be able to draw upon. If I have enough money to leave my home, go stay in a hotel where there's air conditioning and a much better environment, that makes a difference, of course. But of course, not everyone can afford that. And those that can afford that are stuck sort of in their own home. They may not have even transportation or the ability to be able to make a difference and be able to change their environment. Also, lack of air conditioning, as you would expect, and also poor urban land use patterns. So if we knock down too much of the green space inside the cities, we make the cities hotter. And those inner cities, once again, other issues related to social and economic status and so on, all of those are complicating factors that are all human factors making this worse as well. The lack of early warning in these particular events too, the lack of forecasting and any lack of the ability to be able to provide that warning to people in different locations that may be at risk also increases the health impact of heat-related disasters. The lack of evacuation to a cool shelter, whether that be due to social reasons, due to other factors that may limit the accessibility of people or their mobility may make a difference as well. Also, this lack of interpersonal socialization. So if people are isolated and they don't really have anyone to reach out to that they know, that they trust, there's people not checking on them and people not interacting with them on a daily basis where we can find out that people are getting into trouble and we can intervene at a time when it's still enough time to save their life. So that makes such a difference. And can you see this thread that's going through what I'm talking about for this entire seminar? We're really talking about people helping people. And that's what we're here for, right? That's what we want to make a difference, is because if socialization makes a difference, that's it's a very pleasurable thing to have people that are looking after people. It feels good to do so. It feels good to have people that are looking after you as well. So, this idea of interpersonal socialization and its impact in disasters, we really have to recognize that and be able to support that and promote that at the neighborhood, at the family and community level. There are also measures that reduce the health impact of heat disasters, and we can look at that in terms of reducing exposure in the short term and also reducing exposure in the long term. So let's talk about short-term exposure reduction. One is heat wave hazard mapping. We can map the cities themselves, these urban areas, identify where these high risk areas are for heat. We can monitor those areas and forecast those when we talk about what the weather may be tomorrow or the next day and so on. Providing early warning so that people can have some time, bring some resources together to be able to protect themselves or protect family members or to check on family members that may actually be isolated. To provide risk communication to those people that may be at risk so that we tell them how to protect themselves, how to cool down, how to limit their activities, how to access cool environments and shelters and cooling stations around the different neighborhood that we may be able to move them to safe evacuations, and then provide for them safe shelters. Not only safe shelters in this terms of coolness and temperature, but also safe shelters where they feel comfortable and they feel secure. And this aspect as well of community outreach is also important, an important aspect of short-term exposure reduction, where we can actually go around and check on people in the community, and neighborhood watch programs that really actually have an outreach component where we can knock on the doors and make sure that people are okay instead of no news is good news. That's not always the case. We also want to reduce exposure in the long term once again, right? And we've talked about this with nearly every disaster that I've shared with you in this particular seminar. The idea of making long-term decisions and long-term developmental decisions that change building codes so that we have cooler buildings and cooler shelter for people to begin with. And then utilizing land use and regulating land use in a better way in the city so we have more green space and cooler cities, and we don't have these heat islands that we're building in the cities where everything is a concrete heat sink and pulls in all the heat from the surrounding area. And then finally, recognition as well that there are occupational health and safety issues related to heat. So people that are out working in the heat all day long, being able to provide them with the information and the training and the adjustments that they need in their jobs so that they can limit the amount of heat illness that they succumb to as well, not only in the extremes of age, but people who are in those wage earning years so that they can work in highway, working in construction, working in other areas where it may be high levels of heat over extended periods of time in their particular job. Keeping an eye on that occupational health and safety issue is very, very important, not only for the folks that are working on a daily basis, but also those emergency responders that may be called upon to actually provide aid as well. And finally, reducing the vulnerability as well. health promotion, reducing health disparity among these populations. Now, we talked about, there's a really important socioeconomic component to this aspect of vulnerability to heat wave disasters. We know that there's a demographic of age, elderly. We know that there's a disparity between different ethnicities and different races, different populations, different subpopulations as well. So if there's a disparity of health within certain populations, elderly people in poor neighborhoods that aren't getting medical care on a good day, then those are the most vulnerable on these bad days when the heat disasters occur. So when we lessen health disparity in our country or in any country, we're actually bringing people together, we're bringing the whole community up, improving the health of the entire community together. We lessen heat disaster related deaths and illness. By improving personal mobility, we allow people to become more interactive. They're able to evacuate to cooling stations much easier, and also good community communication as well as public knowledge and awareness of these heat disasters. All of those things combine together to make healthier people that are less susceptible to the heat to begin with. We also build this capacity as well for healthy people, healthy buildings, and healthy communities. So healthy people have good public education, they have good socioeconomic status, they have good access to health care. Healthy buildings promote structural mitigation, they cool themselves, they don't become heat traps where all the heat is built up and poor ventilation. In addition, healthy communities help to build public services and infrastructure that actually withstand these types of events. We have less power outages, and also this idea of social cohesion and inclusiveness. Outreach into the extremes of age, different socioeconomic statuses, and so on. We really have to think in terms of being more holistic in the community in order to build this capacity to be resilient.